The Prime Minister will set out his plan for social care in England today, saying it will fix a broken system in which people face catastrophic costs.
He's expected to announce a rise in national insurance of about 1.25%, despite criticism from Conservative MPs.
But on the very day in 2019 that he became Prime Minister, Boris Johnson made this bold pledge.
We will fix the crisis in social care once and for all with a clear plan we have prepared.
6 months later, during the election campaign, he made another bold pledge.
We can do all these things without raising our income tax, VAT or national insurance contributions. That's our guarantee.
Words from Labour, who say the increase is unfair to working families. Here's our political correspondent, Ian Watson.
It has plagued previous governments. Plans for reforming social care in England have often come unstuck. But on the very day in 2019 that he became Prime Minister, Boris Johnson made this bold pledge.
We will fix the crisis in social care once and for all with a clear plan we have prepared.
6 months later, during the election campaign, he made another bold pledge.
We can do all these things without raising our income tax, VAT or national insurance contributions. That's our guarantee.
Now it seems he can't keep both promises, so he's on the brink of breaking the pledge not to increase national insurance rates. The Labour leader, Keir Starmer, says this would be unfair, as it would hit working people hard, including low earners and young people. But perhaps more worryingly for the Prime Minister, many of his own Conservative MPs seem to agree.
I don't want to see national insurance raised for people of all ages. I think many youngsters have paid enough as a result of this pandemic. I think if we want people to be able to retain their homes, then those people should bear the bulk of the cost, perhaps by buying their own insurance policy to insure themselves against a catastrophe of potentially losing all their money on care.
Initially, the extra cash raised isn't expected to be earmarked for social care, but to help clear the backlog in the NHS in England, which has been pummeled by the pandemic, and to increase hospital capacity. So there are concerns that social care could still be left as a poor relation.
We are really hoping that there will be something, not only for the long-term sustainable future for social care, but we do need something immediately now, because most care providers are at breaking point at this moment in time.
And the problem of paying for care predates the pandemic. Boris Johnson says he won't duck tough decisions and he will end the catastrophic costs of care. So ultimately, those costs will be capped. But even some of his own MPs wonder if he'll be able completely to prevent some people having to sell their own homes to pay for a care home. Ian Watson, BBC News.